grace, we are fine.
Nice to have both of you in the studio.
Thank you.
How is the Ablekuma Central Health Directorate?
Ablekuma Central Health Directorate is doing fine. You know, it's one of the newly created districts. We are challenging a lot of things, but by God's grace, we are managing.
It's new, so you are now setting up.
Yes.
One at a time.
Yeah.
Well, first of all, let me start with why you're here. First, polio.
Okay, thank you.
What is polio, and tell us a bit about it.
Okay, thank you so much. We are solely here this morning because of the immunization on polio vaccination campaign, which is a national immunization that we are doing. We did one in September, and this October we are about to do the second round. If we say polio is a disease of filth, or it's a disease that is highly infectious that affects children under 5 years and 15 years of age. It's a fecal-oral route disease. When we say it's a fecal-oral route disease, that means one way or the other, you indirectly ingested someone that is having the polio virus fecal matter, which is feces, through contaminated food or through contaminated water into your system. The polio that I earlier on said that is a disease of filth. So if someone is having the polio virus, it is transmitted by the person doing open defecation, or what we normally do by wrap and throw.
Okay.
When we are having the polio virus and then you do wrap and throw, and it rain or children mistakenly play around that area, and then they pick up the virus and they did not wash their hands well before eating, and they ingest the virus, they may get the polio disease. However, polio is a viral disease. Okay. When we say it's a viral disease, that means it's like this COVID and other viral diseases that we have HIV in the system. Okay. It doesn't have any cure. However, we have interventions that we put in place, like vaccine saves lives, that we put in place to help reduce the polio disease in our country. And it has helped us a lot. So that's polio.
Okay, so usually when you talk about polio, what you are looking for is a form of disability. That's what we see as a manifestation of polio. So if someone has polio, how would you know? Is there a way through which you would know that the person has polio? I don't know who to direct.
All right, so polio, as you mentioned, it manifests itself with disability. It affects mostly the limbs, the hands, and then the legs. It can affect both legs and hands together, or one leg or one hand, or both legs and both hands as well. Okay. So that is how polio manifests itself. Yes.
But can somebody have polio without the disability that comes with it?
The case definition by WHO is the sudden paralysis of the, as he said. So those are the major signs and symptoms that will alert us to know that this is a suspected case of polio. Okay. However, the paralysis comes in as a result of it affects the spinal cord, and then it also affects the brain. So the brain is connected to the spinal cord. So that is why the paralysis comes in. So however, it can affect any other part of the body, but it's mostly commonly associated with the extremities, being the arms and then the legs. Yes.
What you talk about as how polio is transmitted.
Yes.
Because recently, one of the things that the Ghana Water Company Limited was complaining about was that people was discharging fecal matter into the water which they process and send to our homes. You're saying that could be the main cause of that. That essentially means that if someone who has polio I don't know how to put it.
Okay.
We could have a serious case on our hands.
Okay, we are saying that polio is a disease of filth. That means we get it through our environment,
The
dirty environment.
Okay.
However, before someone gets polio, polio is transmitted. We earlier on said that it's a fecal-oral route disease. That means you indirectly ingest it, like it enters into your mouth, through your mouth, into your system, into your body system. You've eating, you indirectly taking somebody that is having the polio virus feces, which is the fecal matter, through food or water. You know, there's in Accra, we do a lot of irrigations, and a lot of wrap and throw goes on, and open defecation where they go and do their free range at the seashore and other places. So if someone is having this polio virus and go and do his open defecation free range and then wrap and throw, and we fetch into our sea water bodies, and then water is collected from these places and used to irrigate our vegetables, our crops, and you buy those things, you didn't wash them well, you can pick the polio virus from there. However, if someone also defecates, we have a cycle where someone who is having the polio virus defecates without washing, either open defecation or through our standard defecation or standard toilet measures that they put in place. So the person didn't wash his or her hand well, and then the person touches food or that person shakes you, and you didn't wash your hand, you have picked the virus from the person. If the person is having the polio virus, you just pick it. If you didn't wash your hands, you can, and then you eat, you can ingest the polio virus. The information officer.
Yes. So to your question, the treated water from Ghana water, it's relatively safe. Because it's been treated. So even if it has the virus, the possibility of the virus going through the filtration, the treatment, the chlorination is less. Yes, so we might have it in the water bodies, but
it has undergone.
It has undergone treatment. So it's not likely that somebody might get polio from the treated water from Ghana water.
Having said that, then who is at risk of polio transmission?
Mostly children under 5 years and 15 years of age. They are at most risk of polio virus disease.
Children under 5 years?
Yes.
And then under 15 years?
Yes.
So
from birth to 15 years, they are at risk of polio virus disease. However, it can also affect adults. So you cannot, there's no vaccine for we adults. So we should improve on our personal and our environmental hygiene by frequent hand washing and then putting the hygienic measures in place as an adult to help prevent it. But the main is children under 15 years.
And I'm guessing that's why you're doing the whole polio campaign. Explain to us exactly what that involves, why you're doing the polio campaign and how you're doing it.
All right. So we have what we call sentinel sites. So recently, from time to time, we have field officers who go to pick samples from these sentinel sites. And then from the samples from the sentinel sites, we realized that we recorded cases, positive cases from Askwari Mampong. We recorded positive cases from Ashaiman and about 5 more sentinel sites, which means that we have the polio in circulation. This means that we have to do something about it immediately to stop the disease from getting to our children. Or if a child has even picked the virus, we need to put in vaccination measures immediately to prevent them from developing the polio. Yes, so essentially that is the reason why we are having this vaccination.
So it means we are seeing some cases of polio in the country, and there are urgent steps to ensure it doesn't spread?
No, not polio cases. From Sentinel side, we pick samples from, we have places where we pick the samples.
Okay.
So it's not from human beings.
Okay.
We pick it from we
have some designated
places.
Okay. Like
some
Agbogbloshi.
water bodies, Agbogbloshi,
Okay.
water bodies, big gutters, where we have some drainages and other places. And we also have septic tanks, places where we pick these samples.
I'll go up and ask, what is AFP?
Okay. AFP is Acute Flaccid Paralysis, which is a case search that is a case search that we do at the facility level or the community level to identify polio cases. Okay. Acute flaccid paralysis is a sudden weakness of either the arms or the legs, which occur suddenly under 15 years of children under 15 years of age. Okay. So that is AFP, acute flaccid paralysis, which is a case search for polio.
Is how you know somebody has polio.
Yes.
So if you have any child 15 years and below with a sudden onset of paralysis, maybe the person is unable to lift the hand or the leg. It could be from maybe he fell down and then he's unable. It is possible it could be polio. So we need to take the person's stool sample and then send it to the lab for investigations.
I wanted to find out, once you detect something like that, is there anything you can do? Or then it's beyond you?
When it is detected early,
preventive measures.
We can put preventive measures from in place to prevent the case from deteriorating further. Okay. So a classic polio case, you see that if it affects the hand becomes very small, and then it becomes ineffective. Yes, so there are preventive measures we can put in place right at the onset to protect the child from the deteriorating.
So what that means is that if there's a parent who sees that all of a sudden your child's arm develops some form of paralysis, is unable to work, has grown leaner in size, are they supposed to contact you?
Okay. They are, apart from the sudden paralysis, even if your child goes and play ball today and tomorrow the child is limping, we are saying that don't link it solely to the ball. It can be something else. It can also be a suspected case of polio. So we have health directorate in all the districts. Then we have public hospitals in all most of the communities. So they should link up to either the health directorate, the public hospital, or the child welfare clinics that they organize at the community level. They should link up with the community health nurses or the community health officers. Then we pick it up from there.
Well, let's come back to the campaign. When are you starting the campaign? How long will it take?
All right, the campaign is for 4 days, and we are beginning on the 6th of this month.
6th of this month?
Yes.
That's in 2 days?
Yes.
Okay.
So we are starting on Thursday.
For 4 days?
For 4 days.
All immunization?
Yes. So we have trained nurses together with volunteers from the community who would go from house to house, school to school, and then all public places, churches. If there are public gatherings, they would go there to immunize the children.
Children under 15 years?
No.
Oh, okay.
As children.
Explain the strategy. How will it happen?
0 to 5 years.
0 to 5 years?
Yes.
Okay. Children 0 to 5 years will be immunized.
Yeah.
Okay. Then perhaps let's end with, aside this is part of what you're doing to protect the general public from the risk of polio. What interventions are you using?
Okay, for Ghana Health Service and its partners, we put a lot of interventions in place. One is the routine immunization services or activities that are ongoing in the community, the weighing or the child welfare clinic. We have supplementary immunization activities that we do to help reduce this polio and other diseases of public health importance. Okay. We also have national immunization days campaigns like what we are coming to do now. Okay. And we also do mop-ups, quarterly basis, where children that we are expecting at the weighing sectors, they didn't turn up. We reach them at their doorstep and deliver health services to them. So these are the interventions that Ghana Health Service put in place. There's also ongoing health education and then case search or surveillance activities are also ongoing. So you can we can realize that the surveillance, this campaign that we are doing is through routine surveillance activities.
We are in Ablekuma Central. So which areas are you covering?
Okay, so our areas include Abusokai, Mataiko, Shukura, Latebiokoshi, Russia. Yes, so these are the communities that make up Ablekuma Central.
Okay.
Yes. From Graphic Road.
Okay.
Yes, the gutter that it's a river. Yes, the river, the Odo River. From the Graphic Road towards Hansonic.
Okay.
Yes, and then down through Russia, Shukura, and then the road just in front of us, Radio Gold, and then to the Chemu Link, all the way to Mango Down, Banana Inn.
Okay.
Yes.
So all of those areas, all the areas that are part of Ablekuma Central.
Ablekuma Central.
But this is a national exercise.
It's a national exercise. It's being done across the country.
You cover every community, every area within 4 days.
Yes.
Wow. That's fantastic. Anyway, we have to bring this to a close. Maybe I'll take your concluding words. First, let me start with you, Marcus.
Okay, so the last exercise that is the first round, we had a few issues with hesitancy.
Okay.
Some people, for some reason, refused or they didn't allow us to vaccinate their children for fears of whatever.
Okay.
But then we can assure everybody that the vaccines are 100% safe.
Okay.
So even if your child went to the child welfare clinic yesterday and we come today, they can still take the vaccine. It is 100% safe. It's been approved by WHO. It's been approved by the Food and Drugs Authority. And all of us here are parents and our children took it. If it's not safe, we will not allow our children to take it.
Marcus, thank you. Before you give me your final word, Pearl, for parents who are actually resisting, what is their reason? Is it?
Like he said, most of them think maybe the vaccine is something different. And then most of them that are having newborn babies think we may end up contaminating the child. But he earlier on said that we have trained nurses and trained volunteers that will be going from house to house. So the vaccines are safe. And it's the same vaccine that we are using at the child welfare clinic. It's the same vaccine that we are using for the campaign. It is safe. And we are using the community health nurses who normally provide these weighing services to them. So they should allow us to immunize their children together for all of us to protect ourselves or eradicate polio from Ghana. And then the target for the campaign, as he said, is children under 5 years. Yeah. They are the primary targets. The secondary target, we have parents and in-laws, mother-in-laws, father-in-laws. Those of you that are listening to us, please, we are begging you. We know you are the decision makers. You decide for your in-laws whether we should immunize them or not. Please, We have been with you for a very long time. Ever since they introduced vaccine into our immunization system in Ghana, we have been with you people. And you know vaccine save life. This time, we are seeking your support to allow us to immunize the children in-laws. And then the tertiary target, you are part, Radio Gold, you are part of our tertiary target. We want you, as one way or the other, to be chipping in the vaccination campaign whilst it's ongoing in the community. Our chiefs, our elders, our religious leaders, we are seeking your support to help us create awareness on this round 2 polio immunization campaign.
The in-law aspect is what took me by surprise. There are major source of hesitance here. Pearl, thank you.
They decide, yes.
Thank you. Thank you very much. It's wonderful to see you. Marcus, who is Health Information Officer, and Pearl Joji Walker, who is Health Promotion Officer, Ablekuma Central Health Directorate. And they are very close to us. Yes. So wonderful to see you. And I wish you all the best.
Thank you so much.
Yeah. So the immunization exercise starts from 6th October. That's in 2 days. Today is Tuesday. So Thursday, they are starting the immunization exercise. If you are anywhere and you can hear the sound of my voice, make sure you make your child available to be immunized from polio. Thank you.